All right, one of our favorites, Dr. Zach, is back, of course, ER physician at the MUHC, drzach.ca, by the way, if you want to find him. How are you doing?
I'm good. How are you?
Good. You have a bit of a scratchy throat, but
yes,
that's okay.
It's not West Nile.
It's not West Nile,
no.
which is what we're talking
measles,
about today.
nothing.
Or measles, none of that stuff. Let's talk about West Nile, though, because it seems to me that it was in the headlines quite some time ago, and then sort of disappeared, and now it's back. Before we get to where it is exactly, what is the West Nile virus?
So it's a virus,
yes,
obviously, but it's caught, unlike measles, which we've been talking about. Mm-hmm. It's not super contagious. You don't catch it from other people. You catch it from the bite of a mosquito.
Right.
So it has to be an infected mosquito. And yes, that's right. There's been a couple of articles about it recently, although I don't think it's really, usually it peaks towards later in the summer.
But it's it's already around now.
It's already, they're already talking about it.
Yeah. Oh,
I don't.
They.
I read an article yesterday in the newspaper about it, but they haven't actually, so basically the Montérégie, south of Montreal, is the place where most of the cases tend to happen. Last year there were 76 out of 201 cases in Quebec happened in the Montérégie.
And what is it exactly? Like, how do you know that you have it?
So basically, like a lot of viruses, it's not that obvious. You can get fever. First of all, by the way, about 80% of people have no symptoms at all, and they're just fine, and they don't even know they have it. So it's only 20% of people that get any symptoms at all. The people who do, it's like a flu-like illness. So fever, vomiting, diarrhea, aches, joint and muscle aches, and some people get a rash.
And who's most prone to getting this?
So the most susceptible people are sort of the classic, especially as opposed to measles, excuse me.
And poor Zach.
Which is in mainly the very young, very old. People over 60 are more susceptible, and then anyone who's immunosuppressed. So if you're on chemotherapy, for example, if you have AIDS, other people who are, like if you have kidney disease, diabetes, cancer, any of those things make you more susceptible to catching it.
And so, okay, after the rash, after all those symptoms, does it have any sort of permanent effects on you?
In most people, so in those 20% of people who do have symptoms and then get this sort of flu-like illness, it goes away. Some people do have a few weeks or even months of kind of fatigue kind of symptoms, but then it goes away forever.
Okay.
The reason people talk about it really is that 1 in about 150 people who get it, who have the virus, actually can get very sick with something called encephalitis or meningitis, which is an infection. Infection, inflammation around the brain. And so that is potentially life-threatening. About 1 in 10 of those people can actually die. So last year, out of 201 people, actually the number is a bit higher, they say, Public Health in Quebec says about 15 people actually died last year
15 people
from
died.
West Nile virus.
Okay, and so we said it's primarily in the Montérégie
right
now?
So 76 out of 201 last year was Montérégie.
So let's talk about what we can do to avoid it, because I was just telling you that our boys in the backyard have one of those little baby pools, and there was a bit of water in it, and so I kicked the water out. So water, little pools of water.
Yeah, standing water, because mosquitoes love to breed in standing water. So if you have anything, we all have, whatever, even upside down frisbees or whatever, where
there's
water
always a
pools.
little thing in the backyard.
Exactly, and water's pooling in it, and mosquitoes love it.
Okay.
So dump those out.
Yeah.
Dump those out because mosquitoes love them. And the mosquitoes specific to West Nile virus love dusk to dawn.
Dusk to dawn.
So those are the particular times when you want to be most careful about trying to avoid getting bitten at all.
Okay.
So meaning, insect repellent containing DEET, or there's a bunch of other chemicals.
Is DEET okay for kids? Which was the one that I'm not supposed to put on kids?
I think young kids, look on the label, I think young kids it should be avoided. So, so then there's a problem. So then you try and keep them inside, use screens.
Hi, have you met children? They just want to be outside. Exactly. You met 1 or 2. You have 17. Yeah.
Long sleeve shirts.
Yes.
But you're right, it's a bit, all these things sound a bit crazy, especially today when it's over 30 degrees.
Yeah.
But again, during the day, you're less worried. Montreal, fortunately, we don't have many cases. So, again, 80% of people won't even have any symptoms. So I don't want to be alarmist about it, but people should be aware of it.
Yeah.
And if we do hear that it's really becoming a real risk, people should take measures to protect themselves.
Okay, so to be clear, so anyone with a sort of compromised immune?
Yes.
Over 60, not even elderly, over 60.
Yeah, that's the number they give. I'm a bit surprised by it also because obviously 60 is not particularly old. 60
is like the new 40, I've just decided, by the way.
I agree.
And then the other thing, what do we say about babies and small children? Yes, no?
Well, babies and small children, they're more susceptible, certainly under a year, they're more susceptible to
just to anything at this point.
Yeah.
Okay, and so no DEET, you don't think for the kids, long sleeves, loose...
Long sleeves.
What do we say? If you're going to go out in the woods, cover up, close up the enclosed, don't let anything come in there? Or am I confusing that with ticks?
Well, that is ticks also.
That's ticks and mosquitoes, and dusk to dawn, the moments to avoid. Okay.
Exactly,
Again, still a problem mainly in the Montérégie, but has affected a few people in Montreal. All this information, by the way, is going to be in our show notes. Dr. Zach Levine, ER physician at the MUHC, drzach.ca. Go get better. Go have a little tea. Does that work?
Sure.
We'll get into it. Okay, stay tuned.